Veronica is a 13-year-old girl presenting with 1 month history of generalized abdominal pain that began at the start of the school year, and she rates it a 6 out of 10. She describes it as both dull and sharp with no specific triggers or relief. Interestingly, the pain improves on weekends when she is not in school. She also reports ongoing nausea, frequent tension headaches, fatigue, and episodes of diarrhea when the pain worsens. There is no vomiting or weight loss associated. She expresses significant anxiety around school due to bullying, which she has not disclosed to staff or her parents. She states that bullying makes her feel embarrassed, contributes to her symptoms. She has difficulty falling asleep and occasionally takes Benadryl to aid. She feels most tired in the mornings and during school. Her mother has given her Tylenol without relief. She denies sexual activity and has not started menstruating. Lives with both parents, younger brother, denies illicit drug use, alcohol, marijuana, tobacco use. She feels safe in the home but not at school due to bullying. Her review of symptoms was notable for fatigue, nausea, diarrhea, sleep difficulty, and anxiety. She denies fever, weight loss, vomiting, chest pain, urinary symptoms, or thoughts of harming herself. Her vital signs are stable. Her temp is 36.7 Celsius. Her BP 110 over 70. Heart rate is 70. Respirations are 20. She weighs 92 pounds and is 4 feet 9 inches. She's well nourished, well developed, alert, oriented, and cooperative. Her abdominal assessment showed soft, non tender, no guarding or masses. Her hint, cardiac, pulmonary, neuro were all within normal limits. Her psychiatric, she was calm, maintains eye contact, appropriate affect, dressed appropriately, and speech is soft but coherent. Her assessment, differential diagnosis, functional abdominal pain, psychosomatic, due to Veronica's daily abdominal pain that is chronic, non-localized, and not associated with it physical exam findings or red flag GI symptoms. The timing of the symptoms worsens during the day but improves on the weekend, strongly suggests that it's stress-related etiology. She also reports associated symptoms of nausea, headache, fatigue, diarrhea, and poor sleep. Her physical exam is benign and there is no signs of organic GI disorder. This diagnosis is supported by literature noting that psychological stress in adolescence can increase visceral sensitivity and cause functional GI complaints. We can also rule in and out GAD as it is relevant for Veronica due to her somatic symptoms, sleep disturbances, and anxiety related to bullying. Her physical complaints, abdominal pain, headache, fatigue, and nausea are common in adolescents with anxiety. However, her symptoms appear to be situational, not pervasive. Since her anxiety does not extend across multiple areas of life, GAD is less likely and can be ruled out. IBS can also be ruled out as she has occasional diarrhea but does not meet full IBS criteria for pain and is clearly not related to bowel movements, and symptoms improve on weekends, which points more towards psychosomatic in cause. Abdominal migraine can also be ruled out. Even though she reports nausea, headache, and abdominal pain, her symptoms are continuous rather than episodic, making this less likely. The plan is to give her amitriptyline 10 milligrams QHS for functional abdominal pain and anxiety modulation, hycosamine ER 0.375 milligrams BID for GI spasm relief. For diagnostics, we should do a CBC and a CMP to rule out infection, anemia, and check the liver and electrolytes. Celiac panel and stool studies if the symptoms persist. A GAD to assess anxiety level. We should refer for a CBT for anxiety and for somatic symptom management. Encourage daily physical activity and regular sleep, and have her keep a pain diary to track symptom patterns and stressors. I'd like to refer her to a mental health specialist to help her with the bullying, anxiety, and GI if the symptoms do not improve. I've also explained to Veronica and her mom the gut-brain interaction and how stress contributes to physical symptoms, address potential stigma around mental health, and encourage open discussion. We emphasized hydration, healthy eating, and avoiding missing school. I would like to see her in 2 weeks to assess medication response and coping progress, and sooner if the symptoms worsen or new ones develop.